when we first talked, one of our conversations about why we wanted to do this in some background way was that we both had pretty intense medical experiences. And can you tell me a little bit about that and how that's kind of shaped where you are in terms of your approach to medicine and where you are professionally and personally?
Yeah. Well, it was after the birth of my second child.
Yeah.
And I actually have had some chronic medical issues, but I think it all culminated after the birth of my second child about 4 weeks later, and I became very ill, and I required 2 surgeries and 3 hospitalizations over the period of 2 weeks. And all the while having a 4-week-old and a toddler at home. So, and initially it was all in my field. Being an OBGYN, I actually, we can reason through anything, and I think we're used to putting our head down and getting through things as doctors. And so I initially was like, okay, well, this is what has to happen next, and this is what's happening to me. And then things started getting more serious and outside of OBGYN. And that's when things got scarier for me.
Yeah.
And that's when I no longer hospital stay. But I think...
Did you feel scared?
I did.
Yeah.
Yeah, absolutely. In medicine, we talk about this impending sense of doom, and I had one of those moments.
You did.
For sure, yeah.
Yeah. World closing, getting smaller.
Absolutely. I was staring at my mom holding my 4-week-old baby, thinking, I'm not going to raise that child. And I thought it was a panic attack. Later, I think it was an internal hemorrhage, I realized, that was causing me to have my body actually was saying to me, something's about to go really wrong. So I had to rely on doctors I knew, doctors I didn't know. Luckily, we're in a small community here, and I even tracked down one doctor in the hospital. I saw him walk by, and I wanted him to be my doctor, and so I got my IV pull and went down the hall, and he took one look at me, and it's like, well, I know you, and I know you just had a baby, and I know you have heparin dripping, or you have pulmonary embolism. I said, yeah, will you take over my care? So I think, it was scary for my family and for me.
And it sounds like it was so meaningful, those connections you had with those individual physicians when you were really sick.
It was vital. Yeah, I mean, it really was. You have to trust who's taking care of you. And initially, when I was admitted, I didn't know the doctor that was on, and I knew the ER doctor. I knew who I trusted, and he was all the time in contact with my old mentors from my residency program, and so I relied heavily on them, absolutely. And then I remember everyone saying to me, well, the silver lining is you're really going to be able to relate to your patients more. And I think at the time I didn't want to hear that, because I just wanted to get through it and wanted it to be over. But that was true. I think I can really understand and relate to what it's like to be scared and what it's like to feel like your body's not working and not functioning the way that you want it to.
Can you tell me a little bit about that trust moment? Because I know exactly what you're talking about. And it's so interesting as a physician when you feel that bonding of trust to another physician, because your life is on the line. Can you tell me a little bit about that, what it was for you, and maybe talk about that?
Yeah, I mean, I think maybe as physicians we look for different things. We know, I mean, everybody wants a competent physician. Everybody, I think, wants a doctor with decent bedside manner. But also, we know exactly the care that you're expecting. So then I think it does help you know how to, what someone would want in that situation and what to deliver. I had a gut feeling in my whole pregnancy. Actually, I chose my partner for a reason. And I remember saying at one point that, he needs to be my doctor, because if something really goes wrong, he's going to have to save my life. And unfortunately, he did have to multiple times.
Wow. That's a pretty profound bond.
Yeah, I still thank him a lot. And now we joke somewhat lightly about it, but there's always a pretty serious connection moment afterwards.
Tell me a little bit about, then you alluded to how that affects your approach, your how your relationship with patients now.
Yeah, I do. I think I talk very, like I'm talking to you right now. I feel like with my patients, I'm very myself, and I do bring in some personal, tidbits about my own health when necessary. I think usually tell somebody it really needs to be about them, but sometimes it does help for them to have an outside perspective or have that understanding of what you're going through. So I'm not afraid to talk about what I've been through and bring that in sometimes when it's necessary. And so I do relate that to patients, and especially, I think I also have explored many different routes of healing in my life. And so I'm really passionate about that, we do certain things that I can offer certain things, but there's other healers that can offer other things. And sometimes each healer has a time and a place to come in and offer it, or a combined approach. And so I love to bring in other people to work with and provide what I call a true holistic approach.